awesome. We're live, MedTech conference in Toronto, not Mars yet, and I am super excited. We have Hortense and we have Andrew. And tell us a little bit about yourself real quick.
Yeah, really quick. I am an associate director at Bayer in radiology for our digital solutions business.
Sure, and I'm Hortense Allison, and I'm the Vice President, Regulatory Affairs for Bayer in Radiology, where I oversee all aspects of our regulatory, portfolio, from innovation all the way through maintaining marketed products.
And I got Randy here, my co-host, partner in crime.
Thank you. So, all right, Bayer's an interesting company, a lot of stuff going on. What's some news, exciting thing that came out of Bayer in the last year that we might have missed? And did you get to work on it?
Yes, so great question. I would say, the last 12 months at Bayer has really been an exciting time. But before I answer that question, maybe I'll just tell you a little bit more about Bayer in radiology, because I'm not sure that our audience really knows.
Yeah.
When we talk about Bayer, you think about aspirin, right?
Yes.
But it's more than that. So,
A lot more, right?
a lot more than that.
Mhm.
Bayer's mission is health for all, hunger for none. And Bayer is a true life science company with a strong heritage of over 100 years in radiology. And there we're really committed to delivering efficient and optimized patient outcomes. Our portfolio includes contrast media used for CT and MRI imaging. So, when you go to get those procedures, that's injected inside of you. We also have the medical devices for their administration, as well as we have informatics solutions, and we also have an imaging platform that delivers clinical applications. And what I'm most excited to talk about today, Andrew and I, is our innovations in the digital and AI ML space. So when you think about healthcare data, 90% of that data is imaging data. That's a lot. And every year, billions of radiological images are captured. And this number keeps growing worldwide. So this puts a lot of pressure on radiologists who suddenly now they have increased workload. So here we get an imbalance, right? A supply-demand imbalance. And this is where Bayer, our expertise comes in to help, right? Support radiologists by delivering clinical applications on our Calantic platform. And also, we also have an innovation AI hub that will help also with building up clinical applications. Andrew, maybe you want to talk a little bit more about our Calantic platform?
Yeah, so Calantic in general, this helps make it a little bit easier for hospitals and just the radiology suite. When I say radiology suite, I'm talking about the reading room specifically. It helps those customers simplify the integration of clinical applications to help them triage, detect, diagnose when they look at radiology imaging, and really makes it a simpler integration for them in their workflow. So instead of trying to integrate all these individual clinical applications one by one into their IT infrastructure, they just integrate the platform. And the platform, that's what hosts the clinical app.
It's almost like a conductor orchestrating a symphonic experience.
Yeah.
Yeah.
I'm just thinking about days at work where I'm using 6 applications all in the same task and multitasking between screens. And I wish there was a better way as I'm writing down notes, having that work.
Yeah.
So you're tackling that challenge for radiologists.
Yes.
Yes.
And that's with our Calantic platform, right? But there's another platform that I'd like to talk about that's really coming off in the last 12 months. It's our AI innovation platform. When you really think about developing a clinical application, particularly for detection or diagnosis, it's a very complex and challenging process. There are challenges around making sure that you have access to high quality data, right? Integrity. And also, you have to think about the amount of data that you will need to be able to train and develop that algorithm, an enormous amount of data that's needed. And then you also think about, you want to make sure you're developing that AI in a very secure, right, and also maybe a collaborative space where you can work with other developers. And so this is where our AI innovation platform comes in. This platform was developed in partnership with Google. So it's a Google cloud-based platform that offers a safe, secure space for developers, clinicians, startup to come in and be able to develop their AI, their clinical applications. And what's also interesting about this platform is that the platform has the potential, or we can facilitate rather, access to unstructured data that you can then use to accelerate your development.
Like, what would be an example? I know CT discs, MRI discs, X-ray discs, but like, what's unstructured data that they would use?
So, for example, data related to imaging data, more or less, right? For
Maybe
a patient.
If you know of a patient or set of patients that have a particular condition, you want to be able to go get that data so that you can train your algorithm on it. Yeah.
Very good.
Wow. The thing that gets me is this is not easy. Everything I'm hearing is just wow with getting digital health right, especially in MedTech.
Yes.
You guys made
Share-
it easy? You fixed it?
Yeah, we wish.
Well,
We-
we're supporting the journey, right?
Yeah.
But it's never easy. It's never easy at all. And for this, you'll see that some developers, they have good ideas, but they fall short during development because of the things that I mentioned before, the access to data, good quality data, having a space that they can work in securely, cybersecurity issues that they have to think about, regulatory issues and so on.
Yeah.
So here's a very global company.
Yeah.
Right? These products are sold all over in many regulatory jurisdictions, I guess how you'd say, or countries.
Yeah.
What have you seen about as you do more with software and AI inside medical devices in many countries? Are we kind of all figuring it out? Is it getting easier? Or are certain things more predictable now because another company's done something that's sort of in the range so you can look to them? Where's all that right now?
Well, I would say, one, it is definitely not harmonized. And in certain instances, certain countries, I should say, the regulations are still very unclear. And so this is where the opportunity for industry to partner with regulators is so important as we help to shape what regulations will be in the future, what guidances will be in the future.
Have some things gotten clearer over time?
I mean, the work of IMDRF and other leading regulatory bodies has helped, clarify some things. But I mean, when you get down into the details of the submission, you're working with the individual reviewer who might have their own interpretation of what those broader policy statements are. And sometimes that makes it challenging. But like ultimately, you work through it with that reviewer, and maybe you run into some issues where you get tossed out of the review and you have to go back and submit again. But like you learn along the way, like what is acceptable, what is not acceptable.
The trade craft of what you all have to master, just is amazing to me. So, what else? Thanks for joining us. What are you looking forward to at the conference besides talking to us?
Yeah, obviously. Yeah, I would say anything AI related. I mean, that's the hot topic. You see that in a lot of the sessions today. I think that carries through the rest of the conference also. Like, it's just AI is seen as something that has beneficial effects for impacting workflows, making things simpler. There's a lot of promise, and we'll see how things progress and are implemented ultimately.
I would say exactly the same thing, Andrew. Today's our first day at the conference, and there's definitely a lot of excitement around AI. All the sessions that we've been to so far, they've all been AI. They've all been in a very positive light as well. There was at one time we questioned, is AI going to be the future? I will say it is no longer the future. It is already here, right? And we can see there's not one person I talked to today at this conference that's not utilizing AI, whether it's internally or externally, to advance MedTech.
Thank you very much for coming out and have a great
Thank
conference.
you.
Thanks
Thank
for
you.
sharing.
Sure,
Thanks for having us.
Yeah, thanks for hosting
We're
us.
really awesome to have you.
Thank you.
Andrew, great to have you.
Appreciate it.